Hey guys, welcome to another video on epidemiology. And in this video, we're going to talk about epidemiological terms. Apologies if I hadn't covered this, that I haven't covered this before, because really I should be. This is the first thing I should be covering about epidemiology instead of surveillance or preventions or something. So, anyways, let's get started. So the first term we're going to learn about is cluster, and cluster is really just a aggregation of cases in a very close period in a very close space or place. And a cluster doesn't have to be more than the expected number. It really just is saying that there's some cases in this very specific place and this very specific time. Maybe we should investigate. It's like I said, it doesn't have to be about the expected number. Our next one's endemic disease, and it's like a disease that's just always constant. Like they always have a constant presence in a population or a geographical area, and they have agents or causes of the disease, and there's always some all of the risk factors associated with endemic disease. So just sum it all up, endemic disease is really just a disease that's constant, like all the time in a continuous level in a population, in a specific population or geographical area. So our next one's epidemic. I think I think a lot more of you guys know this term because a lot of news outlets use these terms. But really, endemic is a large number of people having the disease in a very big geographical area. Our next one's etiology. Etiology is the study of disease. This really hasn't to do with anything much with epidemiology, but it's just a pretty important term out there, so that's why I just put it there. Fomite, it's very interesting. It's like a vector, which I'll talk later in the video, but it's not really. It's a physical object that's a agent from person to person. So for example, one example I can put is lice on a comb. So for example, lice is a physical object, it's an animate object. If someone has lice and they use that comb, then there will be lice on the comb. And then somebody else using that comb who doesn't have lice will then also get lice. So this is a fomite. It's in a recap, just a physical object with a disease that transmits from one person to the other. There's also laterogenic, which is a disease caused by medicine or physician. A common form of laterogenic disease, I think, is superbugs. Superbugs are bacteria resistant to antibiotics, and that if you didn't take the correct amount of antibiotics or took too much of the antibiotics, what you would do is that you will make a lot. It's like you will have a very high chance of creating bacteria that's resistant to antibiotics, since you didn't follow the guidelines. It is it's emerging problem, and yeah, that's really just laterogenic, just a disease caused by a medication or physician. Incubation period, I think a lot more of you guys know, it's the period for a disease to settle in and let the symptoms occur. So for example, some diseases like AIDS have incubation periods of years, which means that you will not feel anything really until like years later. Like it's kind of scary, especially like the disease that have higher incubation periods. It's like we got feel sick and like you just go to hospital and you never realize that like you forgot what caused it. That's what's make it scary. The next one is index case or patient zero. Pretty straightforward. It's the first person who got the disease. I don't have anything more to say other than that. And like it's also kind of useful for research because like from patient zero, the researchers can actually like understand like who, how did the disease go into human, and like how, you know, how the person got it. And like it's probably like can be served as a control. Like if you were to take the patient's tissue or like the sample virus, you can use it like as a control for like other mutations. So next one is isolation. And isolation is simple. Isolating the sick. There's a pretty big difference between isolation and quarantine because like isolation is like when you actually isolate the people you actually know who are sick. Quarantine is just a safety measure because like you are staying away from other people while isolation is other people staying away from you. But I'll talk more about quarantine. I'll talk about the difference like later. But like a cicala, it's a disease. It's a disease that like is a condition that's like the consequence of a past disease. So like for example, I don't really like bringing stuffs up, but like I really like to say a lot of things about disease because like it's a pretty sensitive thing, especially those very challenging disease. But one example is probably the HPV virus and cervical cancer, because uh, cervical cancer serves as like the cicale. It's a consequence of having the HPV virus. If you don't know, HPV virus is a human papillomavirus. It is the main cause, if not all the cause, of cervical cancer. Morbidity is just the rate of disease presence in population. This is more like epidemiology and statistics. It is very, very hard since you need to have a very strong statistic background to understand most of the contents in like epidemiology statistics, but then like I'll explain it later in the video where I'll try to make it understandable. But for now, morbidity is the rate of disease in the population. Mortality, I think a lot of you guys understand, it is the rate of death in the population of a disease. And our next one is outbreak. It's like more cases of a disease in a population, a specific population or geographical area over like a particular period of time. It's it's like a, I would say a between cluster and epidemic, but like that's just how I would say it. Our next one is pandemic. I think all of you guys know what a pandemic is. It's an epidemic, but over a even larger area of geographical area. Like it should be spread across continents and a lot of countries for it to be a pandemic. Our next one is plague. It's a very, very serious potential life-threatening infectious disease that is transmitted to humans like with like actually pretty very specific bites from rodent fleas. I think a lot of you guys know about like the Black Death. That is a plague, specifically bubonic plague, and bubonic plague is like plague that is like has characterized by like swollen lymph nodes, and of course it could be easily treated with antibiotics, but if you don't like like go to hospitals or like seeking medical attention, it's very likely that you could die from it. There's also symptomatic, I can say, septicemic. It's really like where the plague, instead of swelling the lymph nodes, they multiply in the blood, and like pretty much the same story with the bubonic plague, but buboes, which is the swelling of lymph nodes, don't develop. So and then like this could actually lead to a complication called pneumonic plague, which affects the lungs. And in the end, I think a lot of them, in the end, like it is just not safe to like interact with plague. But of course, bubonic plague is like it is in the U.S. at least it is pretty controlled. There are like pockets of cases and like places, but overall, like you don't need to worry about bubonic plague. Especially that even if you get it, there are antibiotics to treat it. So our next one is nosocomial disease. It is, by a simple definition, just a disease acquired in a hospital. It's very different from like what I said back that laterogenic, because sometimes like if you're sick, maybe sometimes like it's a hospital's fault. Like they didn't clean the room properly, and like there are still pockets of disease here and there. So then that's why there are that's how you can like get the disease. Doesn't always do medication. And like most of the time, I know nosocomial disease often had to do with people with weakened immune systems. And like most of them, I feel like are like superbugs or like antifungal resistant. Since like of course they're all like spattered in the hospital where there's a lot of medicine. So our next one is quarantine. It's it's you not not going face to face with other people. You're staying away from others because you might have a disease. So the difference really is that you may for quarantine, but you are in isolation. So that's a really difference between quarantine and isolation. The next one is surveillance. I think, yeah, I covered this in a video back then. It's really just like the collection, analysis, interpretation of like health data. It's to gain knowledge of like the problems in the community. It surveillance is a community wide thing, and like it can help us like prevent and control the disease. So our next one's vector. Vector is a animal that transmits a disease but does not cause the disease. So for example, a mosquito is a vector because they transmit the disease malaria, but mosquito itself did not cause the disease malaria. However, things like swine flu or something, like I think they came from bats. I think the bats created disease, so that's why bats is not a vector, because they themselves transmitted disease, but they also created the disease itself. So next one is zoonosis. It's a disease that's transmissible from animals to humans. The most basic one is of course rabies. If a rabies dog bites you, seek help immediately. Our next one is symptomatic. It's symptomatic is like for most of us, it's like when we get a disease, we will show symptoms of the disease. Asymptomatic, however, are people who got the disease but does not show symptoms of the disease. So, for example, and actually no, there's no example. It's a really good example for me to say, but those people are probably the most dangerous because they look all healthy, but then when you interact them, they have the disease and you also get a disease. They're like carriers because they walk around like thinking they don't have the disease, but in the end, like they really have disease. And like people, there are like things like immune people and symptomatics are like the same, but however, those two are not the same. Immune people, like when disease entered your body, the body eradicated the disease immediately. But however, in symptomatic, the body did not eradicate the disease. However, they still have the disease because of that. So our next one is hollow endemic. It's like hollow endemic really just has to do with like kids overall. It's like endemic for kids. For example, like most kids are probably susceptible to like rubles, measles, something like that. And so that's really just hollow endemic. And then like another trait about hollow endemic is that more kids have it, but like the ratio of kids to adults having the disease is like very high, like it's like 5 to 1 or something. And our last one for this video is the Hawthorne effect. Hawthorne effect is of course another psychological statistic concept. It's that if a person knows that they're being observed, they will modify their behavior. So like for example, a very I'm not going to put any disease example or something, but example for hollow endemic in like let's say parenting is that let's say the kids always play video games and the parents are not observing the kid, but however when the parents are observing the kid is probably like actually doing their math homework or something. That is like the Hawthorne effect. But then of course what I put was instead like a parenting example, but I think you guys can like make a method out of like oh in like disease and epidemiology or something. So that's the end of the video. Thanks for watching.